Hi, welcome back to Rohrich Knows Podcast. I'm DrRohrich. I'm a board-certified plastic surgeon in Dallas, Texas, and helping you become a better and informed you. Well, we've been doing the podcast for a while now, and people always ask me, said, well, what is your background? What do you do? Where do you come from? And so I recently did a podcast for one of our journals, Global Open, with an amazing plastic surgeon from the UK, and he's here with us today. So, Mamil, welcome to my podcast. And Dr. Gokani is a consultant plastic surgeon, which means like he's a board-certified plastic surgeon, but he's a consultant plastic surgeon in London. And welcome. Thank you. I know it's late in the UK, but we really appreciate you joining us.
Absolutely, Dr. Rohrich. It's an absolute pleasure to be here. Thank you so much. As you said, we had a chat about a month or so ago, maybe a little bit longer, and we really got into the weeds of you and kind of and the essence of Rohrich, what it kind of feels like, not what it means, what it really feels like. And I thought we'd kind of dive into that, if that's okay.
Yeah. So just have at it. I mean, nothing's no holes barred here. So he's going to ask me the questions. I'll be like, okay, let's do it.
Well, so I'm going to start with the beginnings, the origin story. Tell me about your background.
So, well, I grew up in a small little village in North Dakota called Zeeland. It's a German-Russian community. I didn't speak English till I was 6, and it was a farm and a ranching community, and that's kind of where I grew up with the work ethic and surrounded by, people that really helped mold me, just like, anybody else. Those formative years are the first 5 to 7 years of your life. It was great. A little cold, though, in North Dakota.
different to Dallas, eh?
Yes, a lot different.
And any siblings?
I have 2 older brothers, one of them who runs our ranch and farms now, and then one who's retired from the military. So, but they were all a couple of years older than me, and I was the youngest in our group of 3. So 2 older brothers.
You'll keep in touch?
Oh, absolutely, all the time. In fact, I just celebrated my birthday, and they all came. They live all around the country, and we're very close. And unfortunately, my parents have passed, in the last couple of years, but they were awesome. I mean, they really helped mold who you are, and they certainly did that in my life as well.
So tell me, what if I was going to ask you, what 3 things did you get from your parents that really came from your parents then?
Well, I would say, first and foremost, it's get up early, work hard. The work ethic is unbelievable, and be straight and honest with yourself and the people around you. And if you do all those things, you'll be successful in life. And really, those are the things that we did every day. We got up early, we did all the chores, then we went to school at 7, and we always said what we were going to do, and we delivered, and that's what my parents showed us. And I think the biggest thing they showed me also is that, they don't just talk about it, they do it, and they lived it. They were farmers and ranchers, and that's a tough life. And you grow up with that work ethic, I mean, there's no turning back.
There's no doubt that you have that in you now. I think I've heard you described as the hardest working plastic surgeon in the world.
I don't know about that.
That's, I've heard it said. But kind of going back, were you always going to be a plastic surgeon? When do you remember thinking, I want to do plastics? So how did you get into medicine first, I suppose?
Well, I got into medicine because there was nobody. First of all, I didn't have any role models in medicine because the nearest healthcare facility was 100 miles away. So it was very Darwinian. If you survived to get to that healthcare facility, you could get healthcare. So I just wanted to be able to say it, I want to become a physician because I wanted to help people get good healthcare. And, where I grew up, healthcare was out of reach, really. We barely had veterinarians because, there's probably thousands and thousands more cattle and animals than people in North Dakota. But healthcare, even today, healthcare is so much better there, but it's still remote. So to me, it was a reach of wanting to say, hey, why can't we do better, and why can't we get health care, for people that are, that need it.
So take me through your medical training. Where did you go to med school, and from there?
Well, I went to medical school at Baylor College of Medicine in Houston, and which is a phenomenal medical school. I really, it was the beginning of who and what I am in plastic surgery. And when I went to Baylor, it was a place where cardiac surgery was king, and Dr. DeBakey was walking the halls, and I was fortunate to be on his service. And of course, he was a world famous heart surgeon. And that's what we all wanted to be, until one day he said to me, why don't you go see this plastic surgeon who's a friend of mine? It happened to be Mel Spira, who was the chair of plastic surgery there. And he was doing a cleft lip, which is a hair lip. And I said, wow, that's amazing. And he said, why don't you just scrub in? And I was a third-year medical student. And I said, sure. And after that, changed my life. After that, I said, okay, I want to be that. I want to do that. I want to be able to take somebody that's, physically deformed and restore them and make them look normal. And so that got me into plastic surgery, because after that, I said, that's what I want to do. No longer heart surgery. And thank goodness, because, it changed my life. But, you always have to do something that you would do without being paid to do it. So I go to work every day, and I'm not really working. I'm doing the things I love to do to this day, 30 years later. And that's, I think, what drives each of us. And it's so hard sometimes when you're talking to people that don't love what they do, and they say, I can't wait till I'm done with work. I can't wait till I'm retiring. Are you kidding me? And that's the difference, I think, for us and for you as well. Don't you think? I mean, you love what you do. You told me you did this microsurgery case under local today. I mean, I could see it in the gleam in your eyes that you love that. And so if you love what you do,
they pay me to do it. You're right.
Exactly. If you love what you do, you never work a day in your life. And, my mother told me that so often,
I mean, that's so true. And plastics is so varied. How do you decide, or how did you decide which bit you loved at the time? Because you've been through a number of careers throughout your career.
Right. Well, you know what? I'm a slow learner. I didn't learn immediately because, I did craniofacial and pediatric surgery at Oxford. I went to the University of Michigan. Then I went to Oxford. I did craniofacial pediatric surgery with Mike Poole, a great unit at Oxford. And so I loved craniofacial and pediatric plastic surgery. And then I came back and I did hand and microsurgery at Harvard with Dr. Jim May. So I did all of those things, and I combined them, and then I came to Dallas to help start and really, make the program at UT Southwestern and Parkland what it is today. And it was all focus, hard work, and never giving up. I mean, there's obstacles in the way every day, and I think people should not view obstacles as getting in your way, but as stepping stones to success. And I think people today don't do that. They say, oh, I failed. Well, look at your great leader, Winston Churchill. If he'd have said, I'd give up, man, we probably wouldn't be where we were today, because he really was the guy that was responsible for really helping us win the war, I think. I mean, obviously, in getting the U.S. in it. So.
Yeah. I mean, you talk about lots of lessons that you've learned. Who do you think was your biggest influence at work?
Oh, at work. Okay, I would say, I've had several incredible mentors, from Dr. Spira when I was a medical student to Drs. Dingman and Grab. These are all big names in plastic surgery in Michigan. And then, of course, Jim May in Harvard. And then it's people like Jack Gunter in Dallas who really brought me here, because he was a world-class plastic surgeon and a rhinoplasty surgeon. But I think that finding the right mentor at the time and emulating him, and then being able to incorporate what they do, and then you know what? You want to go above and beyond, because I love it. I've had I now have over 10 people that run plastic surgery chairs in the United States. And, they're all rock stars, but they are now doing it better than I did. And I love that because you want people to do better than you. And so on the shoulders of giants, you can see new horizons, I always say. So, and I try and tell my kids that too. And so I think being around smart people helps you. And I always tell people, remember, in your life, you only have 5 people that will change or influence you. So choose them wisely. They better be you never want to be the smartest guy in the room, and you always want to learn from them. So if you're not the smartest guy in the room, you got to get out of the room. And if you're not with people that are really energizing you, they shouldn't be your friends. So I like to hang out with people that are smart, that are engaging, and that are fun too, and help you be a better person.
And for anybody who hasn't heard of all the names you've mentioned, I mean, I can categorically say that I've either used books they've written, papers they've written, or kit they've described this week.
Yeah.
They are real giants whose shoulders you stand on. And you keep giving back, don't you? You have trainees,
right?
And fellows who come and learn from you,
right?
And how do you think they describe you?
How do they describe me? Well, I think they're energized because in the mornings I get there at 5:30, 6:30, and I do my elevator talk coming up and talking to them, and then I try and energize them with, a thought for the day or something that they can learn that makes them appreciate why they're here training with me, whether it's a pearl or something about themselves. Because, when I train people, I want them not just to learn the art of plastic surgery, but I want them to learn about how to be the best person you can be. And there's a big difference there. So, one of the residents that was with me recently said, the great thing about coming to visit with you, Dr. Rohrich, is that, not only am I learning, the best of the best in plastic surgery, but I'm learning what it's like to be a person and to love what I do every day. Because I like to emanate positivity, and if you're not emanating positivity, why are you here? And and I do that with my patients too, because sometimes patients, they come in and they're not as positive as they probably should be. So you have to elevate them. And in plastic surgery, half of what we do is psychology and psychiatry, and the other half is plastic surgery, because our goal is to energize them and say, hey, this is really, what we did is really good for you, and don't worry, the result is going to be forthcoming. And certainly in what I do every day in rhinoplasty and faceless, everybody has to go through the wound healing period, so we have to keep them, pumped up during that time period.
But do you ever get tired? I mean, you get to work at 5:30 in the morning. Do you ever get tired?
Well, yeah, but being tired is kind of you can get energized pretty easily. But of course you get tired. I mean, I try and get more sleep. I used to be able to just get 3-4 hours of sleep, and I'm trying to get 5 or 6 now. But I think, life is not a dress rehearsal, so you don't want to spend a lot of your time sleeping. So you want to keep energized. And, I think the biggest thing with keeping energized is staying focused and have a purpose-driven life. If you are purpose-driven, I think everything else falls into place. I see so many people that, they retire, they go someplace, and all of a sudden they're not doing well. You can't walk your dog every day or play golf every day. You've got to be focused on what's next. If you don't have an energy level or some type of anticipation of what's next, I don't think you're helping yourself.
And so we talked a lot about work and keeping up energy at work. Do you go home and just want to down? And how do you make sure your family gets the best of you as well?
Well, it's work-life balance. And of course, my kids are now grown, but, I think am I good at work-life balance? I don't think I was initially. I think I was better for my daughter than for my son. But, you try and, they understand. I think one thing kids know is that they're very smart. You can't tell them what to do, but you can show them what you do. So they're both incredibly smart. One's a world-class ballerina. Now she's going to go to medical school. The other one is computer science. But, they watch what you do. you can tell them do your homework, but if they also see you doing your work and working every day, I think that's important. And my wife's a plastic surgeon as well, so it's very important for them to see who you are, because it's all about role modeling. You can tell them stuff, but it's role modeling, and people want to role model after people they want to emulate, and also I think it's good to do that and to give back, and hopefully I've instilled some of that in my kids. Time will tell, but I think I have. And sometimes I'm sure they think, God, Dad is just, he's over the top. He's asking too much of me. But, so my residents do the same thing sometimes, and my fellows. But, I never, ever ask anybody to do anything more than I would do. So whether it's rounding in morning or night, I never tell or ask anybody to do anything I wouldn't do myself. And I think that's important versus, you see people that tell people to do things, and, it's got to be a level of respect that you have for yourself, but also for others. So.
You said your wife's a plastic surgeon. Did you ever do you work together?
Yeah, well, we have in the past, but she's in private practice by herself, but she just actually recently retired. But no, we did work together sometimes for complicated cases, free flaps and things like that. But she does primarily breast and body. I do, I do face and nose.
Did you ever think of having a dual practice office or clinic where?
No, I don't think you should do that. I never did that, because I think, first of all, I was in academics till the last 10 years, and she was in private practice. But I think, it's good to have that professional space. We talk a lot about medicine, obviously, and plastic surgery, but I think it's good to, that's just in my world. And she is, the guiding light, for myself and also for my kids. So, it's good to have that space. Yeah.
Yeah, and do you think that helps you to have balance and helps you to have a work-life balance when you don't work together?
Yeah, I do. I really do. I think it helps you to become more focused on what's important. Like in your life, it's it's your kids, and at the end, you always have to say, well, what's really important? All these other things, traveling, and lecturing and doing all these things, that's important. But in the end, it's about your family and your friends, and did you make a difference? Did you really give back? Did you really change, what you set out to do? Did you change plastic surgery? Did you make it a better place? And, if you can say yes, then that's laudable.
I saw on Instagram that you recently had a lovely birthday party.
Yes.
What caught my eye was the number of people who I see are absolute celebrities who were in your midst at that party.
Yeah.
Your friends are the giants in plastic surgery, aren't they?
So, well, yeah, a lot of them are. We grew up together. Remember, you surround yourself with great people. You want to become great, just surround yourself with great people. That's why I have a great staff. You're only as good as the staff with you, and the weakest link is what really is the weakest link in your whole life. So, yeah, I am very fortunate to have great friends, great friends, great family, and it was fun. My wife put it on, and it was super. We had like 100 people from around the world, but it was great, and it was fun. But, it's part of, what you do and what you give back. I think that's important. Yeah.
And I wanted to ask, and tell me if I'm out of bounds here, but you talked about retirement. Do you think about retirement?
Yeah, I think retirement is one of those, effusive goals. I think you should think about what's next. You should think about what is next in your career. What's next that's going to be purpose-driven in your life? I look at it like that, and I would say, what is next is what I think I can really still master and do something that's really, really focused in the next 5-10 years. So it really should be what's next for you, and it's different for everybody. And I think that what is next really puts in the perspective, and as long as you love and are great at what you do, you should keep doing it, because I see people that are 30, 40, 50, 60, and they like or don't like what they're doing, and so I'm trying to emulate those that have been very successful And most of the time, it's people that are very, very focused and purpose-driven on being excellent at what they do. Whether, you go and become, a coin collector or become expert at something new, that's what's important, and it energizes you. So right now, what I do energizes me a lot, and that's, operating, teaching, lecturing around the world, and hanging out with my kids. I mean, those are all good things. And as long as you can do that, and you have to stay fit, mind and body, because one begets the other. And I think that becomes more important, as you mature in life. So I think you shouldn't neglect any of that.
I'm going to go for it. We want to get to know Dr. Rohrich. What is next? Give us a scoop. What is next for Dr. Rohrich?
I think doing things like this, talking to people like you, I think I love doing, I love teaching globally. One thing I learned in COVID is that, I used to go lecture to 200-300 people or 50 people. During COVID, I could lecture on Zooms to 700-800 or 1,000 people, especially in the peak of COVID. I'm going, wow, this is pretty impactful. And I think so COVID had a lot of negative things, but the positive things was that it gave you an incredible reach to give back and do things. And that's one of the reasons we started my podcast, and getting involved in the plastic surgery channel with Dr. Adams has really been great, because the world today is not just here in Dallas or any place else or the UK, but I can reach everybody, and so can you, by doing things like this. So that's the global what's next for Rod Rohrich is, making a more of an impactful impact in a different way, in education and other areas too. But I think that's what's next for me.
Well, I remember during the pandemic, you very kindly spoke on my lecture series,
yes,
where you had a packed room, 1,000 people over Zoom, with 453 in the waiting room. So you had a big number. But that leads me on to this, and it's the word expert. Okay, people band around the word expert quite a lot, and people talk about you being an expert as well. But what makes, I'm going to go for it, what makes you an expert?
Yeah, well, I think it's really probably three things. It's your ability, your experience, and your experience in having done, let's just say rhinoplasty, your experience having done over 8,000 rhinoplasties, and then your expertise in being able to teach it and innovate in it and help others become experts. That's number two. And then number three is really exceptional results. So in other words, you can't only show them, you can teach it and have to have others do it, but you also have to show excellent results. So those are the three E's: experience, expertise, and exceptional results. That makes you a true expert today. Everybody's an expert on their website or on social media, and they say they are, but there's very few people that are true experts in anything. You can be an expert in probably two things in your career, and two or three things. And I think that's pretty good, because being an expert means that you're a game changer. You are truly making a difference. And it's impactful. And if you can impact and change somebody's life, that's a big deal today. I mean, most people, when you walk on social media, they're just blabbing. But if you're going to be impactful, you're going to say, wow, I'm going to change what I'm doing. I like that. And
you've recently been named kind of one of America's top plastic surgeons, especially for rhinoplasty. Can I ask, what does that mean to you?
I don't think it means anything more than just being recognized for what you've done for many, many years. I mean, honestly, I was named actually number one in rhinoplasty, facelift, liposuction, and eyelid surgery. But, I think that isn't as important as really you're being recognized for things that, we've done for 30 years. We've been teaching, giving back, lecturing, lecture around the world, operate around the world. I think it's just being recognized for some of those things that you have done and are doing. But, I mean, there are a lot of experts out there, but, there are certain different echelons of expertise and experts in every field, whether it's breast reconstruction or or facelifts or rhinoplasty, and that doesn't mean you're infallible. That means that you probably have made more mistakes than anybody, and you know how to fix them. That's about it, So, and nobody's God. I mean, before I came over here, I just did a really hard revision rhinoplasty, and I'll tell you that it challenged me to use so much of my expertise, and that's a good thing. And because, expertise comes from learning a lot of the things that didn't go so well, but learning how to do it right. Because an expert, always is working to always make things, better or best, and that's the difference.
And throughout your career, you've chaired and presided over a number of illustrious organisations, committees, charities, educational events. What is your proudest contribution to the specialty?
Well, I think to specialty, is training, thousands of plastic surgeons in Dallas rhinoplasty, over 17,000. And also my graduates. I've trained over 350 graduates of plastic surgery, 10 who are chairs in the United States. I think that's a very important thing, at least, in the sphere of plastic surgery. I think, and giving back. I think to teach somebody, and when I look at somebody like today, we were talking about rhinoplasty, and I just saw the light go on in one of the chief residents, and that was good. And one of the visitors that was with me, and I think that they say, oh, I finally got it, and I think to me that's very energizing, because it says to me, okay, you know what, the day was good, I always tell people, if you learn one new thing and you give back one new thing every day, then that's your day. That's a great day. And the rest is just, icing on the cake. I do my 3 top goals every morning, and if I finish those, it's golden, and everything else is, cake.
I've learned so much more interviewing a second time, Dr. Rohrich. It's been absolutely fantastic. But I would like to ask you one more question.
Yep.
Can you tell me 3 words that really make you feel Dr. Rohrich? So what are 3 words that describe you best?
Never give up. But I took it from Winston Churchill. Those were his 3 favorite words during the war and then after the war when he was asked to speak. And honestly, life has ups and downs. Success is never a superior trajectory upward. It's always filled with ups and downs, because it's never about the end point. It's about the journey. The journey is the most important thing in life. It's not about reaching that peak, because guess, when you get to that peak, you're always looking at another peak. It's the journey that's so important. And I think, life is a journey, and you have to enjoy the journey. When people say to me, oh, I can't wait till I'm done with medical school, I said, no, enjoy the journey, because it's a great time. Just like in residency, they have no idea. I said, listen, when you're done with residency, then you really got to work. There's no more 80-hour work week. There's about a 200-hour work week. And so life is a journey. Enjoy it. Right?
Oh, that's so true. 200-hour working week, brilliant. All squeezed into 5 days, I'm sure.
Right.
Dr. Rohrich, it's been an absolute pleasure talking to you, and another really inspirational chat.
Good.
So thank you so much for your time.
Well, Emil, thank you so much. You're an excellent plastic surgeon, and you ask very, very, very thoughtful questions. One of the best ever. So I'm very proud of you, and I look forward to seeing you. I want to come back to visit you guys in the UK. I'll have to do that sometime in the near future. I used to come, and I always would go to Oxford when on my way to Europe, but it's been a while. So. Okay. All right. Well, thanks again for joining. It's been an honor to have you with us, and we'll look forward to seeing you soon.